Hi, my name is Melissa Mullen, and I practice functional medicine in South Florida. I also practice an alternative allergy elimination technique called Nambudrapad's allergy elimination technique, aka NAET, and I am almost licensed to be an acupuncture physician. So I have a pretty broad view of both Eastern and Western forms of medicine. This is a presentation that I created when I was in school, and we had a gynecological class, and I wanted to do something that was different because I personally have found in my patients as well as myself that there is most of the time an emotional root or spiritual root to many types of disorders. And I started to see that in terms of gynecological disorders or autoimmunity and patterns and diseases that tend to run in families, there is some sort of a generational trauma. So this presentation is going to be a different perspective, and it's going to combine both Western, Eastern, and personal intuitive experiences that I have had for your learning. Okay. How many of you have ever experienced dysmenorrhea? Painful periods, cramps. It sucks. It's very common, and just because it's common doesn't mean that it is normal. How many of you have had some sort of a hormonal disease like breast cancer, endometriosis, or fibroids run in your family? How many of you believe in epigenetics? This is the new, I will say newer, it's probably around 2011, 2012, since it was taught, at least to me in school. Epigenetics is the science of how our lifestyle, our beliefs, our diet, and stress can turn off or on a predisposition for a disease. So just because you have a disease for Alzheimer's, like the ApoE4 gene, does not mean that you are going to get that disease. Trauma and pain is recorded in the cells of your body through DNA. And how many people really kind of think that way? It is not something that is recorded and taught to us in school. This is very new stuff. But emotional trauma can be the foundation for disease as well as ancestral trauma. So I'd like to invite you to think about gynecological disease and breast cancer through a different perspective. We always have to consider that the body does things because it believes it's a solution to a problem. For example, if you are not dealing with a repression in your voice and you are being suffocated, you can't speak your mind, you're confined to a certain role in your life, you're not happy in your marriage, whatever it is, if there's a lot of suppression, all that stuck energy is going to create, let's say, high blood pressure. It creates an inflammation, and then after time, it's like this explosion of this built up energy, this built up inflammation inwards, and you can end up with various types of cancer or an ulcer, inflammation, just many different things. So breast cancer and thyroid autoimmunity run in my family on my mother's side. Estrogenic breast cancer runs in my mom's side like crazy, all the way back to, at least from what I know, my great grandmother's lineage. I don't know about before her, but I suspect there was probably some sort of a thyroid thing there too, based on pictures I've seen of my second great grandmother and how heavy she was. So my mother had fibroids in 2004, and she developed estrogen receptor positive breast cancer in 2005, for which she had a mastectomy, underwent radiation and chemotherapy in 2006. And that was kind of what drove her into the world of functional medicine and caused her to become a warrior for early detection. She became a certified clinical thermographer, and she's worked tirelessly over the last almost 20 years to tell women about this adjunct screening tool, thermography, to a possibly earlier detection of the vascular changes that are leading up to the formation of a tumor. So it's not going to see structure like a mammogram will see the structure, the physical tumor, but you have to have had a tumor growing for about 8 to 10 years before it becomes an actual tumor, which is what a mammogram is looking for. So if you have less cells accumulated than that, your mammogram's not going to see it. And as well, if you have dense breast tissue, it's possible that your mammogram will not be able to see a tumor as well, which is why now they recommend you have an ultrasound with your mammogram if you do have dense breasts. But I will say thermography can detect the vascular changes to a new blood supply being formed to feed a growing tumor at 264 cancer cells, which is very little, and it gives you enough time to really understand and investigate the reasons behind that. Is it hormonal? What kind of, development? Is it inflammatory? Is it diet? Is it stress? So, going back to my lineage here, I was told my grandmother, my mother's mother, had a breast lumpectomy in the 1980s. And of my great grandmother's 4 sisters, so my great grandmother was born in 1906. They were of Syrian Lebanese descent. Of those 4 sisters, one died from breast cancer, one developed rheumatoid arthritis, one went blind. Not sure what was that about, but if autoimmunity and immune system dysregulation run in my family, it could possibly be a lupus presentation, which does affect the eyes. Why? So one morning in February of this year, I was laying in bed and my menses came or was coming on, and I was having these really bad menstrual cramps, and I had it because there has been many times in the last 3 years that I haven't had cramps. I have had a very normal and easy period. And I know that stress and certainly certain oils you use and there's other factors that can influence your cramps, your B vitamins, methylation, but it would come back sometimes. And I'm laying in bed and I'm breathing into my womb and I have my hands in my stomach, and I like drew my attention there and I said, why? Why is this something I am experiencing? And I recall my mom telling me when she was 17 in her 20s, she had the most horrific cramps, or she would be in bed just crying because of how horrible it was. And her sisters as well have a history of horrific menstrual cramps. So there is some sort of an estrogenic issue there. So I'm laying in bed, and for some reason it comes to me, Rose, one of my great grandmother's sisters, Rose, my great aunt Rose, who I've never met. I never had seen a picture of her, but I had this knowing that it had to do with her, and just that the suppression of the women in that time. And you have to imagine, my family came from Syria, or it's present-day Lebanon, and from what I'm told by my grandmother, my great-great-grandfather, Bashara Eyes, was a very mean, nasty man who had no patience. He really didn't, very controlling, didn't really care about the welfare of his wife, very harsh on his daughters. He had 4 daughters and 2 sons, and he wouldn't allow them to marry out of order of who was oldest to youngest. My great-grandmother had to literally run away and elope to be able to marry her husband. And at the time, there was a stigma with women being married late. You know, if you were in your late 20s, that was considered, oh my God, there's something wrong with you, your self-worth. If you don't have children, you know, it was kind of, that was just the time. And I just had this knowing come over me that the menstrual cramps were a part of the story because of all the suppression. And I believe that as women, our womb is one of our seats of power, that men don't have a womb. It's our sense of being able to birth things, whether it's life or it's ideas and creativity, it's art. And there was so much pain and suppression in women, and I'm not going to say it was only the Middle Eastern culture, but I think it was just the way the world was through across various cultures. We see it in Italian culture, Irish, various Hispanic cultures, Middle Eastern. There's always like that kind of perspective of women. There are expectations of what they could and could not do. And I'm very grateful that I live in a country in America in a time where we are the most free we have ever been in the history of women. There's really no suppression the way it was in the early 1900s into the 50s and even before the 1900s. So, I had this knowing that what happened in my ancestors' lives, my mother's line, caused something in their bodies to say cancer and autoimmunity is the way I will communicate something that I have not expressed. And in Chinese medicine, there's a perspective of autoimmunity, of this buildup, of this pressure. And after a while, it is just an explosion inwards. And we're going to talk more about the specific locations of cancers and what the emotional relation is. I believe for every problem we encounter, there is a need for that problem. Possibly the problem is an frequency or an energetic match for the frequency of an energy within you, right? Now the question is this disease causing energy yours? Or is this something that's ancestral? This is an incredible study that I came across a couple of years ago when I was really learning about how everything we do in our lives matters. And I came across this because I had found a study detailing acetaminophen use in pregnancy is found in 2022 to lead to IQ deficits in babies, whereas women were always told that it's safe. And I thought, why would we ever think that anything we do, ingest, herbs, medications, foods, our thoughts, would not affect this being that is literally feeding off of us, that we're nourishing and growing inside of our body? So I took it to that depth, like, what doesn't affect? And I was unable to come up with something, but I did find something really interesting. So in 2018, a study in epigenetics found that ancestors of the Holocaust survivors expressed these changes in their genes that regulated cortisol receptors. And they found that these ancestors, while they we're several generations removed from the actual ancestor who had gone through the horrific atrocities of the Holocaust. They expressed these changes as if they were the ones themselves who had gone through it. So they suggested that experiences of trauma can leave long-lasting biological signatures in people. So that is the scientific way of showing that ancestral trauma exists. And this, if you look here, the second bullet point, this is, to me, this was the most profound thing. Preconception parental trauma that remains in the germ cell and following conception affects the offspring's development in utero and postnatal phenotype. So let me break that down in layman's terms. A germ cell is a sperm and an ovum, an egg. A phenotype is the way that your expression is of how you look, right? So they're saying that any type of trauma that the parents go through, and I'm going to even say any type of experience, everything that your parents go through, their parents, all the way back, generations upon generations, all that gets recorded and stored in your DNA, in your sperm, in your egg, and it becomes part of you in your story. And it affects the way we physically look. It affects the talents that we have. It affects the habits or the likes, the dislikes, the problems that we might experience in our lives. And that is so powerful because for me, it made me realize that, I'm living my life being a good person, doing good things. I'm taking care of my body, but everything that I'm doing is going to affect my children and the quality of people that are going to descend from me. And that's that is just incredible. So now we're going to jump into Chinese medicine. So there are where do I start? So there are 12 main acupuncture channels. They're the 12 primary channels, and they're associated with our organs like large intestine, our spleen, our liver, kidney, all that. But there are 8 deeper vessels called the extraordinary vessels. Now, these are what we get. We get them from mom and dad at the moment of conception. When your mom's egg and your dad's sperm meet, there is a zinc spark, a spark of light, and you get imbued with these 8 extraordinary vessels. And from those, the 12 organ meridians are formed. So they set you up with your blueprint of who you're going to be, what your destiny is, how you're kind of going to think, how you're going to walk, how you're going to see the world, you see yourself. It's very, very deep. So I'm just touching the surface here, but it also downloads you with your ancestral blueprint. So this is what this is here, right? The Chong Mai. The Chong is known as the sea of blood. It is your connection to the universe, to your ancestral trauma, your blessings, your ancestral information. They believe that the blood holds memory of everywhere that it has flowed in your body, which is why when we feel your pulses on either side, we're feeling the state of the organs. So to further that, the blood holds memory of everywhere it has been, meaning that it holds the memories of your ancestors as well. Yes. So anytime we deal with gynecological issues or issues pertaining to menstruation or any blood issues, we always want to consider the Chong Mai as something needing to be looked at, right? The Qigong also plays a role in the shape of your body. It rules the endocrine system, the thyroid, and changes in the body shape and weight. So, so with the blood holding memory of everywhere it's been, this is why the same talents or problems will run in families, or like an ease that you have picking up a skill that you've never done. It's in your blood, it's in your chunk. So to that point, the energy of painful experiences that elicit feelings of unworthiness or guilt or dishonor also pass through families. And it's my assertion that in women, these areas that we carry a lot of these heavy, low vibrating emotions are in your womb, your hips, your legs, and your sacrum, and your ovaries. It's my belief that the womb is a woman's center of power. It is a part of our inner voice. It is the ability to birth and create things. And on a physical level, when there is an issue with menstrual blood, womb area pain, or hormonally related cancer in feminine areas, could it be possible that there is a disease-causing cellular memory imbalance in the womb? And I think when you have conditions that are running in families, much of it could not be yours, it could be your ancestors. So this is the Hawking's emotion scale, where he has the level of the emotion all the way from the bottom to the top. It's the lowest to the highest, right? And each emotion has a frequency, and the highest frequency are the best emotions, right? And each emotion shares a life view and a God view, but we're gonna only focus on level, scale, and emotion for right now. I want you to think about the patterns that repeat in your life. Think about the patterns that kind of run in families. The most common circumstances that you will see this will be unhealthy relationship dynamics, continuous financial lack, people pleasing, constantly feeling like you're getting taken advantage of, and of course, the same health conditions running in families. The hurt in us has no choice but to be attracted to the hurt in other people. It's because we all have frequencies. Emotions have frequencies. Musical notes have frequencies. Fabrics have frequencies. Plants, flowers, frequencies. So you resonate on a certain level and you attract things to you from that same resonance. So this is a bit what I had said before, right? So across nearly every culture, women have been valued on their beauty, their body, their ability to bear children, and being a pleasing wife. And this is nothing to do with like patriarchy or hating on men at all. Women have so much more freedom in our time to explore who we want to be and to choose what we want to do with our lives. In the last 100 to 150 years, women were only worthy if they did what was expected of them. And it was societally frowned upon to go outside of that. And I believe that caused a lot of repressed anger. There was great shame and fear in getting pregnant without being married, and great unworthiness, guilt, and grief if you didn't get married and you didn't have children. Imagine thinking, what's wrong with me? Everybody's getting married. Oh, Sally got, has 4 kids and she's 19 and I'm 27 and I'm unmarried. But as a result of all those thoughts and feelings, some of the lowest frequency cellular memories get stored in our cells and are passed down to each and every one of us from our ancestors. And I think if we don't recognize this or even work on just kind of trying to heal it, it's from those types of energies that we can unconsciously attract people and circumstances to us to continue to play out these generational patterns. If you look at the scale here, shame and guilt are the lowest vibrational energies. So my belief is that this ancestral pain is a large part of the root of gynecological issues, because I'm going to show you where exactly they show up and what element that's associated with. So in Chinese medicine, there are 5 elements that the ancient Chinese and farmers used to look at the world through. And it was through that worldview that they understood personality types, they understood health, seasons, foods. So in that viewpoint, there's wood, fire, earth, metal, and water elements. Now, the metal element is, oh, let me back up. So each element is associated with a type of tissue, an organ in the body, an emotion, a smell, a sound, a direction, and a color. So the metal element governs the breast, the skin, the lung, and the colorectal areas. The metal element has the emotion of grief, loss, guilt, disappointment, and shame. The metal element is all about self-worth. So if you can imagine, if you are having prolonged grief, you haven't moved on from it, you're feeling like something's wrong with you, you're just always feeling like disappointed, you're guilty, the tissues that are gonna get affected are gonna be breast cancer, skin cancer, lung cancer, and the colon area, the large intestine, and the skin. Those are the 2 main ones. Now we're going to look at the wood element. So the wood element is associated with the liver, the gallbladder. The liver opens to the eyes, and it affects the breast as well. So if you have repressed anger and frustration, if you are irritable and you have so much rage that you're unable to express, you got to imagine that energy is going to explode inwards, and that could potentially also lead to breast cancer. The liver channel itself encircles the genitals, gynecological issues. So this is just one view of that. And while there might not be a lot of Western studies, I haven't looked too deeply into it to exactly support it, but this is through the Eastern view of these things. How do we begin to unravel ancestral trauma? There are many ways, and I want to be clear that we're not going to remove something from our DNA, right? It happened. It happened decades, centuries, or 1,000 years prior. But there are things that we can do to help that fit into us better, to where it's not stuck and causing problems within us. These are the things that I am aware of. So psycho-emotional acupuncture techniques is one of the ways that I have come to understand all of this information. So acupuncture is not just for pain. It can be for many things. It can be for sleep problems, pain, digestive issues, if you're sick, and it can be for anxiety, depression, but there's a specific type of treatment called non-somatic extraordinary vessels, which was developed by Dr. Dan Atchison Neville in Miami, Florida. And when you are probing those 8 extraordinary vessels, they can help bring and bubble up the belief or whatever it is that needs to be seen by you. And once you see it or you realize it, it's like it removes that pressure or that stuck feeling. It starts to change your subconscious beliefs. It begins to change the way that you see yourself, begins to change the way you see the world, how you relate to people. And it's a process, but it is like miraculous. The other one is called ghost point acupuncture. So Sun Tzu Miao developed ghost point acupuncture, I don't even know, like something like 39 AD. I'm just totally guessing, but it's really old. And this was a way he looked at people that have obsession or possession. And it's not always going to be like, oh, you're possessed by something, but it's people who kind of get stuck in loops of beliefs and they can't get out of it. Like you got in a car accident and now every single time that you get in a car, it's like a big panic attack. You can't move on. You're always hyper vigilant. People who get in relationships and they know that they're not good, but they can't seem to get out of them. They keep attracting the same thing. So the Chinese character for ghost is called Gui. And if I don't have it up here, but if you look at it, it has a hook in it in the character. And so ghosts are like the things that are hooked into us or that we have allowed them to hook into us. And so these ghost point acupuncture treatments can remove the things that are hooked into us and really offer profound psycho-emotional transformation. And according to Dr. Lita Herman, she feels that this is even more transformative and kind of faster than the NSEV. But you'd have to go to somebody that's really skilled to discern which one would be the best for you. Number 2 is prayer and meditation. God is everything. God can do anything and everything. All things are possible with God. Before I began learning about acupuncture, Chinese medicine, I started following the Kyle Cease. He was an actor from the movie, was it Not Another Teen Movie? And he played the slow clap guy. He actually went on to become an incredible motivational speaker. And I I learned how to meditate from his videos. And meditating really introduced me to the concept that I am not my thoughts. My thoughts are literally just things that are washing over the canvas of my mind. So meditation is incredible because it's like fasting for your mind. Meditation allows you to like just be with yourself and see what's coming up for you and ask your body questions. Prayer, like my relationship with God was very much strengthened in the last 2 years and even more so now. I've seen miraculous changes in myself, my beliefs, my health, things that I kept trying to figure out myself that I couldn't. And it wasn't until I started reading the Bible at at night and I saw my life completely change even more. So I encourage you to grow a relationship with God. And to that, there are a lot of spiritual roots to illnesses, and it is like in the same vein as the ancestral stuff, because that's a lot of things that is spoken about in the Bible, and the reasons why we have ancestral trauma or transgenerational trauma, and God can help with all of that. Breath work. So part of my realization with this whole PowerPoint started in February of this year when I and my significant other attended a Awaken workshop with Danny Morell, and he did these 3 days of different breath work, and it is the craziest thing. Like, when you do certain types of breath work, when you're breathing, you're flooding your body with chi or energy. And when you have the chi, it brings up the things that you need to see higher. You're breathing deeply, and oh my gosh, I had like incredible knowings that spawned this whole idea of transgenerational trauma. And that's where I became aware of the hips, where I became aware of the unworthiness and the maternal lineage passed down, and the warped way of seeing yourself, self-esteem issues. And I saw the where it came from, and it was incredible. So you can look up on YouTube, there's box breathing, which is where you breathe in for a count of 4, hold it for a count of 6, and then release, exhale for a count of 8, and you do like maybe 4 cycles of that. There's holographic breathing, I believe it's called. It's where you're breathing so like fast, and it kind of puts you in this oxygen deprivation state, and it turns off, I think it's the executive function center of your brain, and you have really interesting other thoughts that come up, and it's like more clarity. And I'm sure there's a bunch of other ones, but I can't think of them at this moment. Working with a therapist. So I did work with a therapist from, I'm gonna say July 2020 through December 2021, and it was really helpful. That was kind of the first time that I realized there was some things that I need to work on. Let's just put that lightly. I had patterns that kept repeating themselves in my life and in my relationships, and I was like, all right, there's something wrong here. I need to look at this. And I was fortunate enough to have a really good therapist who kind of opened my eyes to how we all have programs, right? We all have these programs that we've put in place, or they might be from ancestors, and they're all meant to keep us safe, to prevent us from experiencing discomfort and pain, and or what we perceive as pain, whether it's feeling abandoned or feeling humiliated, not opening up our heart fully, not being vulnerable, various types of things. And it really got me to see that, we're not all bad people. It's that we have these programs that we put in place when we're so young, we don't even remember, and they stay too long, they get too big, and they cause problems when we're adults because we never shut them off. So there is various types of therapy techniques. There's cognitive behavioral therapy, which is where you talk to somebody who they help you to see and change the way the dialogue that you have with yourself. There was a study I posted on my Instagram about how women who had idiopathic hypothalamic amenorrhea, meaning that there's no reason why their ovaries don't ovulate, so they don't get a period. They had these women, I think it was for like 13 to 15 weeks, change the way that they spoke to themselves. And after that 15 weeks, they regained their menstruation back. Can you imagine that? So our inner dialogue is very powerful. And I believe the technique that my therapist used, now looking back, was probably neuro-linguistic programming, which it's a form of programming your mind through speech. I honestly don't know like a deep amount about it, but it's very effective. And if you can find somebody who knows how to do that, it's also really helpful. The other thing that I do is Nambujirpad's allergy elimination technique. And yes, it is used for foods, environmental allergies, reducing it, but it is also useful, which is my favorite thing to work with people, for cellular memory imbalances, meaning limiting or harmful subconscious beliefs, conscious beliefs, or in some cases, we have found generational cellular memories, like things that are not yours, they're from an ancestor, but it's affecting you. And it combines the principles of chiropractic, Chinese meridian theory, and kinesiology. And what it does is it changes the brain's perception of the event or the emotion or the statement, which changes then the micro expression to every cell, and it allows the brain to reorient itself. And from that, you can see profound mental and emotional improvements. I mean, I've seen it hundreds of times with, you treat a NAET trait of food and somebody's constipation goes away. Fear, it's so deep. Maybe I'll do another a specific PowerPoint on that, but I have had my favorite case was, I had an individual who had some severe or not hypo, claustrophobia, where this person wasn't able to even enter a mall for like 10 years or drive by themselves. They couldn't go into a church or a movie theater because of the fear of being trapped and not finding the way out. And this does not always happen where somebody on the first treatment has such massive improvements, but for this person, we treated fear and phobia, and I had him think about all the feelings he has when he's experiencing it. And after the first treatment, their partner had reached out to me and said, yeah, this is amazing. They drove home. We were able to go into a mall, and it was incredible. And he ended up, I think it was about 4 months, and this person was completely better. No therapy, no acupuncture. It was just the reorienting the brain with these NAET treatments. So in my class, I detailed a case study of a woman who had endometriosis, and my point in this was to show that many of her female family members also had a history of fibroids. So, that was my whole thing, is generational ancestral stuff. Who knows what went on in this person's family, that to where this was something the body said, okay, this is a solution to a problem. This was the same case study, and I went into the acupuncture, the treatment, the herbal formulas. So this was a success. Like, the pain decreased from 10 out of 10 to 3 or 4 out of 10. All the fibroids shrunk, the heaviness of the menses improved, better quality of life. So yay for acupuncture. So this was what I gained from my intuitive experience that one time when I was having my period issue, my menstrual cramps, and kind of just connecting with my great aunt. And I asked my grandmother about some of these things because I was trying to put together like, what does this all mean? And so I was able to figure out that my second great grandmother Mary was married to Bashara Eyes, my second great grandfather, and he did not give a shit about her well-being. He constantly was getting her pregnant. She was pregnant all the time, having tons of miscarriages, abortions. My grandmother said when she would sit down on the toilet, the fetuses, whatever stage she was at in her pregnancy, would just come out of her because she never had a chance to heal and regenerate. She had 6 kids, so imagine 6 kids and you have like who knows how many pregnancies in between that. My grandmother said he was very mean, controlling, and just not a good guy. She would run when she would hear his cane, like walking up the stairs. So my great aunts who died of breast cancer, some never had children, some never were married or were married really later in life. I believe that there was a lot of feelings of repressed unworthiness and anger, sadness about the circumstances of the life. And I believe that energy can be passed down through cellular memory. And depending on the emotion, I think it gets copied into the cells of that organ, like liver with anger, rage, frustration, lungs, breast, colon with grief, unworthiness. So something really amazing happened was when I was laying in bed with those cramps, after I had acknowledged my ancestors' pain through this really random spiritual experience, my cramps completely disappeared in that moment for the rest of the day, instantly. And there were no clots. It was remarkable. It was like, I am not even making it up. It was just so crazy. And that's not to say since then I haven't had some menstruations that were a little more painful, but not nearly as what it was before. And everyone since February of 2025 has been a lot easier. Um, and I truly feel like when you kind of allow space for those things to come through you to your awareness, they fit in better, and they don't cause as many problems or stagnation in your energy flow. So I just want to leave you all with this. We can all heal, and it depends on how deep you allow yourself to go. Thank you for your time. Thank you for watching, and I hope you have a wonderful rest of your day.